I have observed that there are two main secrets in the treatment of obsessive-compulsive disorder. When parents follow these secrets, it increases dramatically the chance that the children overcome their obsessive-compulsive disorder faster and with smaller use of psychiatric medications. The first secret is to look for a counselor who is trained to provide ERP. ERP stands for Exposure Response Prevention. This is one kind of therapy specifically very helpful in the treatment of obsessive-compulsive disorder. Not all counselors are trained to provide this kind of therapy, so that's very important that you look for a counselor who is trained to provide ERP. Counselors who are usually trained in cognitive behavior therapy know how to treat children who have obsessive-compulsive disorder using the ERP, Exposure Response Prevention. Another secret in the treatment of OCD is to use a few very helpful self-help books for obsessive-compulsive disorder. One book that I recommend very frequently for parents to read with their young children is this book here, What to Do When Your Brain Gets Stuck. It's a phenomenal book. It's very easy to read. It's not a replacement for the advice from your family doctor or your child's counselor, but can help hugely to make the treatment faster. Another book that I frequently prescribe for families is the book Talking Back to OCD by Dr. John March. I usually recommend that parents read this book or teenagers read it too. Typically older teenagers, like 16-year-old or older. But if your child reads well and is younger, it's possible that your child will be able to read this book with you. Can medications be helpful in the treatment of obsessive-compulsive disorder? Yes, medications can be helpful. Typically, you use medications that are antidepressants that have serotonin properties, like, for example, fluoxetine or Prozac, or Zoloft or sertraline. There are other medications that can be helpful too. But studies indicate that on average, the ERP, the Exposure Response Prevention, is 2 times more effective than medication. That's one of the reasons that's very important that the children receive the proper treatment for obsessive-compulsive disorder. One very sad situation I see at times in our work as a child psychiatrist is that unfortunately the families don't follow the non-medication treatments we recommend. So we recommend the books, we recommend the talk therapy, the counseling, but unfortunately, frequently, the families don't follow these recommendations, and then we end up having to rely on the medications. But on average, like I just explained, the medications for obsessive-compulsive disorder are only about half as effective as the therapy. I hope this information will help your child. This information is not medical advice. Don't forget to talk about what we learned in this video with your child's family doctor or counselor. Please review the terms of use of this video in the video description. I also include an additional list of resources to learn more in the video description, including list of other books that we prescribe frequently for families. Thank you for watching.